So the integrative model really does not fit with the insurance model. And as some of you know, you go see your primary care provider and they don't want to do this. They want to care for you in the best way they can care for you. But the insurance model has really made it so that they see you within about 7 to 10 minutes. And that's typically how it has to work because the fee for primary care providers tends to be very low unless you're doing some kind of procedure or diagnostic studies. We believe that doesn't work. We believe that you and me and us need to spend time to get to know you for all those parameters. Insurance will catch up because they will see that this is the better way of treating people. It is not only a better quality of care, it is actually cost-effective care. But right now they are not there. So we actually, for many of our services, do not take insurance. We did. I took Empire, I tried that ship, and it was ready to sink. Because the fact is the practice has to survive as a business. And it could not survive as a business taking the Empire plan. They paid me 23% of my fee, and that was that I typically spent 3 times more time than you would at a normal appointment. So I was seeing less patients and getting 23% of my fee. We couldn't do it. It was a difficult decision, but I had to make it for the survivorship of the practice. That's one part. The other part is the ethical part. Ethically, if I diagnose you as Lyme, guess what? I don't get paid. Because according to most insurances, which again, I didn't mention it, but the IDSA criteria came out of a group of physicians that had ties to the insurance company. In fact, a significant number of them did. So because of that, if I put Lyme disease on your diagnosis and you don't have CDC criteria for Lyme, I don't get paid. So what do? We gave your symptoms, palpitations, gut problems, GERD, chronic fatigue, joint pain. I have an ethical problem with that. If you have Lyme, I want to say you got Lyme. If you got a heart attack, I say you got a heart attack. If you got an appendicitis, I say you got an appendicitis. It's an ethical dilemma. You have a problem with it? Guess what? Talk to them. Because you are the consumers. I'm not. You are the customers. You don't like it? Demand that they change it. That's what I'll tell you. That is insurance. I know that there were a number of questions. I hope some of that was answered. And now let's...
Some of them are pretty much just basic questions about what the average cost of an appointment are, what types of insurance we do take as of right now. We do take MVP and we do take Medicare. Jen will talk a little bit about Lyme disease and the insurance. So if you come for an appointment for MVP, it is a copay. For Medicare, it is a different type of transaction than you typically have. We're a non-participating office, which means that Medicare sets a discounted rate for our office. You pay out of pocket for that, and then we submit for you. You would get reimbursed afterwards. A typical appointment cost, it depends on which practitioner you'd come to see. Dr. Stram charges based on the complexity of the case. It can range anywhere between about $350 and $450. For Dr. DeRoma's initial appointment's $195. For Jen's, also she charges based on the complexity of the case, can range about $250 to $350. For acupuncture, initial appointment is $95, follow-ups are $75. Where are you located? We do have 2 offices currently. We have one in Delmar, New York, and then there's one in Bennington, Vermont. In Delmar, we are in the Four Corners, so it's right where Kenwood and Delaware intersect, if you're familiar with that area. And then Bennington, Vermont, we're right on Main Street. And I think that's really it as of right now for insurance, unless, so.
Hello, good afternoon. My name's Corey DeRoma, as Dr. Stram said, and I'm a naturopathic doctor. I'm not sure if any of you really are familiar with naturopaths. How many in here have heard of a naturopath? That's great then. And so my training, I did a 4-year postgraduate medical training in Phoenix, Arizona, and we do basically practice integrative medicine because we learn conventional medicine and natural medicine. At the Stram Center, I function as somebody who helps support the body, helps support the system through nutrition, through using herbs, through using these modalities in acupuncture, even medicines, and really that's what I do. So if somebody has, say, a diagnosis of Lyme disease, and they are on antibiotics, and they're having GI symptoms, or they're having suppressed immune function, what I can do is I can help then support the body by using natural herbs to help with digestive symptoms, to help support the immune system. Dr. Stram talked about natural killer cell function and white blood cells, and this is something that can go down or decrease with Lyme disease. And so oftentimes, even before we can start antibiotic treatment, we might want to increase immune function. And how do we do that? We do that by using certain medicinal herbs. Now myself and our Chinese herbalist here and acupuncturist, Chris Riley, we have developed a formula that helps address just that. It has Artemisia in it, which is an herb that actually can help, especially with the spore form of Lyme. It's actually used, the artemisinin component is used as a treatment for malaria. We also have in this formula berberines or golden seal, which also are antimicrobial. They are not only antibacterial, but also antifungal. So if people are having digestive problems like yeast overgrowth or excess candida, then an herbal formula like this can actually help with the GI symptoms as well. So that's really what I do. And some questions that I read through, some people had questions about vitamin D and whether vitamin D should be taken if you have Lyme. That we don't know. We are actually not sure about whether or not one should be on high-dose vitamin D therapy or not. But I can say that vitamin D actually helps to activate your immune system. It helps to activate your T cells and your CD cells. So in my opinion, I don't think that vitamin D can actually hurt. I think I answered some of the GI questions. So cat's claw, so interestingly enough, we have been using at our center a couple of combinations of antimicrobial herbs. One is called banderol, and the other is called cemento, which is a specific preparation of cat's claw. Cat's claw tends to be more of an immunostimulant, but in this way it also is being used as an antimicrobial along with the banderol. So what we have found in using the combination of these two herbs along with the Artemisia and the berberines, that people are getting better treatment response, because really what it is getting Lyme at all those different life cycles. If it can change forms, then we need to be able to have multi-targeted therapies that is going to address many of those different forms, whether that's antibiotics or herbs.
Oh, I don't have my glasses on. This is fun. And I have to hold this because I am postmenopausal, so my memory, I can't spit off these questions like Corey. Someone asked a question about chelating. So for those of you who aren't familiar with what chelating is, that's something that we do at the center. And what it is a heavy metal test. So one thing that has been found is that spirochetes hoard metals, especially mercury. So chelation is something where we give either an IV or an oral pill, and it goes in and it grabs metals from the areas where the metal settles, which is the bone, organs, brain, and tissue. And then you collect your urine for 6 hours, and then you send your urine off to an independent lab. So it's looking at the body burden, lifetime accumulation of metals in the body. Paracelsus Clinic in Europe, which is world-renowned integrative center, they're now seeing a lot of Lyme patients. They talk a lot about metals and Lyme. You can research a little bit there. There was a question about IV versus oral for that. Oral, if you do an oral chelation, it's about a 5% reading, so it's cheaper, more convenient, but by the time it goes to the gut, there's not a lot of that left in order to go into those areas and pull it out. So I usually recommend an IV at least once to get, a really good reading of that. So that answers that one. Let me see. Do you believe some people are genetically or unable to fight the Lyme bacteria? So that's an interesting question. There is a test called an HLA-DR. And you have to get it through LabCorp. It's just a little bit kind of a side note here. And it does look at more of a genetic tendency of Lyme as opposed to mold. There are a lot of similarities between the two. Environmentally, mold toxins in the air. People that have Lyme are often who have a much more difficult time recovering. It's often a test to get after that is done. Like after you've been through antibiotics for a while and get it just to see. So as far as genetics, the other thing I want to talk about is personality. So maybe not so much, genetic is one side, but then the other thing, like what I see with patients who have Lyme, mostly is that they're type A personalities. And I've almost had to I don't often have the chance to talk to patients about this, but it's tick medicine. It's here to teach something. I mean, every illness is here really to teach us something. And it kind of, so as much as we need the physical part of the medicine and, the antibiotics or the herbs or the supplements and all of that, we also need to bring this, I feel as though patients do, to really another level and see what is it in myself, in my external life that, that I'm resisting, or where am I not paying attention to my yeses or nos, or, all of that, making the choices intuitively that we really feel we need to make. Let's see. Yes?
The type A personalities are probably the ones that won't just ignore those symptoms, probably. So that could be even why you're getting older. Type A, because someone else is going, oh, who cares if I got a pain there, or oh, it's nothing.
Right.
Except for the type A pay attention to everything and know that's not really
That
what it
is
is.
possible.
So then, like you said, then it causes them to question a lot, or whatever you were saying.
And when I also, too, have a lot of patients who admit they're type A and will come in and cry, and normally they don't cry. So it's almost like it's like that's what I see is how it really is kind of smoothing out areas maybe that need to be smoothed out for people.